everyone, my name is Kyle Wolf. This is Christina Mogelnicki. We both work at PTSMC Newington area. So today I will be talking to you guys about the overhead athlete, specifically common injuries that we see in this population, as well as ways to prevent injury and to improve performance.
And I'm Christina, and I will be talking about lower extremity injuries related to sports and how we can help rehab, prevent injury, and get players back on the field.
So as we talk about the overhead athlete, first I'd like to talk about common injuries that we see in this population. So first I'll talk about the elbow and then get up to the shoulder. So the first two I'd like to talk about, the first one is going to affect the youth population, typically under 13, 14 years old. And this is Little Leaguer's elbow. So in Little Leaguer's elbow, when this athlete is throwing, if it's a baseball player, a softball player, or if it's like a tennis player, when they're going to serve that tennis ball, when they're up in this motion, when they have to cock back, when they transition from that cocking phase to that acceleration phase, that's going to cause some gapping at the elbow. That gapping, these muscles, these tendons are going to pull on the growth plate. Now over time, in this younger demographic, this pulling can cause irritation, inflammation, and pain at the elbow, and then obviously some need for PT after that. So that's the first one. The second one is going to affect the adolescent population as well as the young adult population, and this is just any UCL injury. So similar mechanism as the Little Leaguer's elbow, as this athlete is going into this cocking phase, transitioning into that acceleration phase, that valgus force, that opening of the inside part of that elbow, that's going to irritate that UCL, which is the ulnar collateral ligament, and that the main function of that elbow is to prevent that opening of the elbow. So over time, with repetition, increased force, increased irritation, that's going to lead to inflammation and pain. So that's the second one at the elbow. And then the third one, which is going to be at the shoulder, is rotator cuff tendinopathy. So anytime you have any type of thrower, baseball pitcher, softball pitcher, tennis player, the rotator cuff is very, very important, not only for generating power, especially again during that cocking phase, that acceleration phase, but also during that deceleration phase. So anytime a pitcher, a thrower, a tennis player makes contact with the ball, throws the ball, as soon as they release that begins that deceleration phase, and that's going to cause that rotator cuff to work quite a bit. So thinking about the rotator cuff, it can contract concentrically, so the muscle shortens, and then again during that deceleration phase, that muscle has to lengthen to control that motion and eventually stop the arm. If this athlete doesn't have enough strength, enough endurance, enough stamina in that rotator cuff, that can lead to, again, irritation, inflammation, and eventually pain. And that's when a consultation with a PT, a doctor, is going to be necessary. So those are the three major injuries that we typically find in an overhead athlete. All right, so after talking about the common injuries with these overhead athletes, now we'll get into the injury prevention and the rehab piece. So one of the big concepts for you guys to understand is that the body acts as a kinetic chain. So if you think about just a regular chain, if one or two links is weak, not doing its job, that's going to set the rest of the chain up for failure. So a lot of the research with overhead athletes specifically is stating that most of the power and the force generated starts with our legs, specifically the hip girdle. So the hip girdle is our glute max, the big guy in the back, the glute med, the smaller stabilizer on the side of our legs, the rotators, external, internal rotators of the hip, and then transitioning up into the core. Those are going to be very, very important to kind of lay down the foundation for most of the energy transferring. So to complement what I was talking about before with the body acting as a kinetic chain, whether you're rehabbing a specific injury at the shoulder, the elbow, or if you're just going through some strength and conditioning to prevent an injury, it's very important to target different muscle groups, different joints in the body, again, because they're all going to be acting as one as you're completing these overhead motions. So today I'm just going to walk you through a very basic and foundational level program. Whether you're a starter or more advanced athlete, this is just a place that you can start. And then obviously if you have more questions, you can reach out to us, or if you do have a specific injury, definitely reach out to us and we can come up with an individualized plan for you. So the first two are going to be for the glutes. I was talking about that before briefly. So the first one is called bridging. Very simple exercise, so make sure your lumbar spine, your lower back remains on the table. You want to push down with your heels to the table. That's going to activate the glutes. Come up, bring your hips through, hold for a couple seconds, and then slowly come down. Really control the descent. With all these exercises, you're going to want to do a couple sets of about 10 repetitions, a couple times a day. If you're a starter, a beginner, youth athlete, every other day is appropriate. And again, as you get more advanced, you can start to do more frequency, more intensity as you get more advanced. So next exercise is going to be clamshell. So that first one, the bridge, is working the glute max. The second one is going to work the glute med, a smaller muscle on the side of your hip. So keep your knees together, about 90 degrees of knee flexion. So bend your knees about 90 degrees. Heels stay together, and the big thing here is your hip wants to stay forward, nice and locked in this position. A lot of patients, a lot of athletes, when they open up their knee, their hip falls back. You want to prevent this. So you can put your hand here to prevent that, that's appropriate. But what you're doing is heels again, stay together. All you're doing, knee comes up, hold for a couple seconds, and slowly control that on the way back down. Same frequency, sets, reps as the bridge, that's appropriate. The next one, we're going to work on a core exercise. So again, staying on your back, very simple. So what you're going to do is take your belly button, you want to draw that straight down towards your spine. So belly button down towards your spine. Simultaneously, you want to push your low back down into the table. As you hold that contraction, a lot of athletes, a lot of patients like to hold their breath. Make sure you keep holding, or make sure you keep breathing during this exercise. So again, belly button down, low back presses into the table, hold that contraction for about 3 seconds. As you continue to breathe, and then you relax. Again, a couple sets of about 10 repetitions. So the first 3 exercises I showed you, the first 2 were for the hip girdle, so the glute max and the glute med. The third one was for your core. Now we're gonna get into the shoulder girdle. So this one, very important for overhead athletes. It's gonna work the rotator cuff. So keep your elbow by your side. The back of the hand is gonna be pushing against the ball. If you don't have that at home, that's fine. You can roll up a towel, works just as well. Again, elbow pushing into your side. You're gonna rotate out into the ball, hold for about 3 seconds, and then you're gonna relax. Same sets and reps as before, 2 sets of 10, a couple times a day. All right, so that first exercise I showed you for the rotator cuff was an isometric exercise, more so for the younger athlete or an athlete that's just beginning their strength program. Once you start to advance and you get stronger, you're going to utilize these bands. So this one, again, working your rotator cuff, elbow by your side, start with your palm almost against your stomach. You're going to rotate out just past 90 degrees and slowly come back down. So you can work in this range right here. If you want to get more specific with the exercise, you can bring your elbow up in this direction and work at this angle. If you want to get very specific, if you're a pitcher, you can actually go through your windup, come down, get into that position where you start to rotate, and you can start to do some of these exercises in this position. So you can make it very specific for your overhead sport.
And now I'll be speaking to some of the common lower extremity injuries that occur in sports, primarily around the knee specifically. So the first one is injury to the ACL, which is the anterior cruciate ligament, which prevents forward translation of your shin bone, your tibia, on your femur, your thigh bone. Typically these injuries are non-contact and result from a quick pivot, a quick turn, change of speed, change of direction. Typically seen a lot in soccer, football, basketball, anywhere where you're kind of getting those quick change of directions. And some of the signs and symptoms that you'll notice with that is the knee will kind of give out on itself. You could hear a pop if it actually tears fully. There are different variations of level or degrees of the sprain itself. So, physical therapy can help treat a full tear. if there's a surgical intervention, or can help treat just a sprain of that if there's no actual tear, but there is a little bit of stretching to that ligament. The next one is a meniscus injury, and so your meniscus sit in between that shin bone, that tibia, and the femur, and help to create more of a cushion between those two. And again, that can happen from overuse of that knee or some twisting force that kind of creates a shearing effect. And some of those symptoms could be the knee kind of buckles, it'll give out a little bit. You can hear an increase in clicking, and you might have a decrease in your range of motion when you bend your knee. And again, these injuries are common in a lot of field and running sports that require twisting motions. And then the last one we'll be talking about is patellofemoral pain syndrome. So your patella tendon is the tendon that connects your kneecap to your shin bone. And all this kind of is caused by is probably an overuse of that knee in terms of either doing too much too quickly after an off season, or overloading it a little too much in some way at a practice or a game, not giving it enough rest over time. There's a couple other components in that can be related to how the quad muscle is functioning as well. And so you'll feel a little bit of irritation with that, typically with knee bending motions such as like a deep squat, if you're going downstairs, things like that. Even running can kind of irritate it. And again, that's seen in a lot of the field sports that require a lot of running and change of direction. Now we'll be talking about some of the injury prevention methods and some of the things you would do in rehab to help resolve some of these injuries. So injury prevention, there's a lot of research out there showing that good strength and conditioning programs outside of sport-specific play can help decrease the risk of injury because they target specific muscles and help to reduce some of those forces and unknowns that happen during gameplay if you're only doing game-specific practices. And then in therapy, the goals are to educate our athletes to a good program, get them going with something that can help them in the future and they can bring back to their team, as well as resolve the injury and get them even stronger than they were before to reduce risk of it happening again. So just to talk about some of the exercises we can do for treatment of knee-type injuries from sports, as well as possible injury prevention methods, are going to be single leg based in the beginning and towards the end of treatment as well, due to the fact that single leg stability helps to decrease some of the risk of these injuries happening. And if an athlete doesn't have good single leg control and they find that their knee kind of wavers back and forth with some of their motions, then that can put them at these increased risk of injuries. So as Kyle was saying before with the upper extremity injuries, it's the same with the lower extremity injuries. We need to make sure above, so the hip and the ankle are also strong. That can help support the knee and decrease those risks of injury. So we look for a few different things with single leg exercises to help determine that. So, the first one we're going to talk about is our single leg sit to stand. So from a normal height surface, probably about 18 inches is a typical chair height. Working on how well can an athlete go down, up, and then there's different variations of this. You can lower it to kind of do more of a pistol squat to get as low as you can to the ground. You can add a tempo, so can you hold here, come up, and that's a good way to see, is the knee coming in this way, is the knee going out, what is the ankle and what's the hip doing? Is the hip dropping on this side The other one is a single leg RDL, which would consist of the person going like this, and up. I should move a little bit here, and up. And then again, looking for those same types of factors. Is the knee going in? Is the ankle wobbling here? And do they have good hip control where they're not moving around that way? And they're staying nice and flat and coming up. And so that's going to work on more of the posterior chain muscles that'll help support the knee. And then lastly is more of a plyometric introduction that can help the athlete get back into some of those more high-level activities such as running, jumping, cutting. And so that's just a triple extension to double leg land. So what they would do here is go up on their toes, extending their ankles, extending their knees, hips, arms, and then as fast as they can, dropping down. What we're looking for there is a soft landing, nothing hard, nothing that you can hear. And that tells us about how much force is getting put through the joints and how well they're able to cushion that landing with muscle absorption and control of their muscles. So again, that looks good there compared to going up, landing very hard here, where they're not really cushioning that landing and getting all of the force through their muscles. So those are some of the things that we would look for in rehab and kind of use as our baseline, either testing or baseline introductory exercises, and then build off of that to work into more of a strength and conditioning plyometric program to get them back to their sport-specific play. Just to further demonstrate some of those exercises in proper form and improper form for good single leg stability. Now you can see more of my whole body here. So the single leg squat to the chair or to the table, which is about 18 inches off the ground here. We're going to go down, knee kind of goes over the toes there. This leg's out straight and hips are nice and in line with each other. If you want to go down a few times, again, you can change the speed, nice and fast, nice and slow and controlled for some of those. And then the things we're looking for, like I mentioned again, is with the knees dipping in that way, core control where you have to use your other foot to stand up and help you. Those are some of the things we're looking at to better be able to train the muscles. Second one is the single leg RDL. Again, hips nice and straight, knee kind of goes forward over the toes, and you're going to hinge at the hips down and then up. And again, down and up. Looking for the same types of things. And so improperly we kind of look like this. Hip might be dipping this way, knee might be going in a little bit, and those gives us a better idea of what muscles to target in training or in therapy. And then the last one was the triple extension to double leg lands. So you're going to go all the way up, and then cushion all the way down. See how low I am when I get down? Using all of my muscles of the lower extremity to really cushion that landing and take as much pressure off the knee joints as I can. Now improperly, and what a lot of athletes make mistakes of, if you're going here, and you just land. I don't know if you can hear it in the video, but that's a very loud landing compared to what I was doing before. And it's harder and stiff on the knees, or I'm not coming down fully and cushioning.
So thank you guys for tuning in. It was a pleasure at least giving you some more knowledge about the lower extremities and the upper extremities, common injuries, ways to rehab them, and ways to prevent injuries in the first place. If you guys have any other specific questions regarding your specific case, injuries, specific strength and conditioning programming, feel free to reach out to us. Our contact information will be at the end of the video. Thank you guys.
Thanks again for listening. Any other questions, feel free to give us a call.